Groundbreaking science, life-changing nutrition.
Fantastic to have you with us. We are talking all things animal today, and the photos coming through are just glorious. We've had Nina gardening, we've had Maggie and Dave hanging out in the back of the car, Dashi warming herself in front of a new heater. I could do with a heater. Get those in on 4001. Use that ARN play up on the WhatsApp too. Every photo, every message, every question will put you in the draw to win. And delighted to be joined this afternoon by Dr. Sahil John, surgical head at Pet First Veterinary Clinic on Hesse Street. Been in the UAE 10 years. Known as Dr. John to his beloved patients, both furry and non-furry. Great to have you with us. How are you?
I'm good. Thank you so much, Helen, for having me at the show today.
I want to know about the menagerie you have at home. Do you have any pets?
Yeah, I do have a Labrador, and it's a girl. Her name is Patsy.
Oh.
And we got her as a small puppy, and she's 2.5 years old.
Is it true about Labradors? They just eat anything and everything?
Oh, yeah. They are considered to be a walking bins, actually.
Well, yeah. We had some friends and they had a dog called Alfie, and Alfie would eat whole packs of butter and, just raw chicken from the side of it. I've never seen anything like it. It's like there was no awareness of hunger or lack of hunger. It was like seafood, eat the food.
Yeah, that's correct. That's very correct. You describe well the Labrador.
Well, lots of questions coming in for you today. But before we get to that, I wanted to come to one of your areas of interest, which is hip dysplasia in animals. Let's talk about dogs in particular. Are there any specific breeds that are predisposed to getting hip dysplasia? And can you explain a little bit about the condition in general?
Sure, definitely. I'll start first of all with hip dysplasia. So dysplasia is mainly derived from Greek word of malformation. And hip is, of course, a joint. We always consider that large breed of dogs are more predisposed towards it. For example, like German Shepherd, Saint Bernard, Labradors even. So again, like those breeds are more commonly presented with such kind of condition. And mainly in ideal situation, like hip bone or hip joint is basically a ball and socket joint. Mm-hmm. Exactly. So in this situation, like, in ideal condition, they both needs to grow together in a same rate. So in a situation where there is malformation, or it's called dysplasia, in that situation, like they don't grow at the same rate. Okay. So this leads to such kind of instability, which leads to pain, discomfort for the pets. However, we always consider, like, large animals are more predisposed to such kind of condition. But we do find out that small animals, even cats, are prone to get such kind of condition.
Now, I first heard about this in babies, because this is something that, a lot of little ones might get diagnosed with quite early after birth, actually, and sometimes might need to wear a brace to help, their body support in that growth. How do you treat it in animals?
Right. Well, just to mention a little bit about comparative studies, as you mentioned about the babies. Well, in human medicine, in some of the countries, people practice routine ultrasounds until the age of 3 months for babies. And there was a very amazing study done back in 2010 by vets. And they were planning, how we can also try to diagnose hip dysplasia in puppies as soon as possible. Mm-hmm. So they took a group of dogs and they did the ultrasound scanning between the age of 16 to 49 days. And the results were quite unremarkable and almost unconclusive, which leads to a very important thing and understanding of this condition is because we always say that humans can be born with dysplasia, whereas dogs, they develop it.
So it's not a case of, there's puppies and they go in for a routine check with their vet. They might be having a look at, bone formation. There might be an X-ray. This could be something that develops later. So what are the signs you should be looking out for as a pet owner? Right.
Well, when it comes to signs, most of the time you see the pet is reluctant to do the physical exercise. Laying most of the time, find it difficult to get up. I would say in cats in particular, which is also a rare kind of situation, like they would find very sensitive on the hip area. They would be licking the hip area more, or they would be hesitant to jump and climb. So such kind of things, like if you observe, this could be one of the conditions that could lead to dysplasia.
And then presumably come to see you, there might be an ultrasound and X-ray, you'll be looking at that joint malformation. What about treatment then? Is it about pain management? Is it about building muscle to support the joint? How do you do it?
Well, again, like when it comes to the vet, first of all, the first thing is physical examination. So in physical examination, we perform the hip extension. And of course, like the dogs or the cats who are having such kind of condition, it's painful for them. Second thing, again, part of the physical examination, we perform Ortolani sign, which is also some kind of test, which tests the laxity of the hip. But again, a our good diagnosis is only achieved by the radiographs. So in that situation, we have to sedate them and then to obtain a good quality X-rays. I would like to touch a little bit more about the age, like, what is appropriate age and when we should be doing such kind of examinations. In literature, it's believed to be that at the age of 3 months, it's okay. You can test it, you can check it, because that is quite the age where there is a ligament which is attaching ball to the socket, anchoring it. And it's considered to be that ligament can tear and then lead to dysplasia. However, 3 months is very early to check dysplasia, especially on the radiographs. So ideally, I would advise like 6 months of time is quite fine for us to check it.
If this is ringing any alarm bells with you, or you want to find out a little bit more about hip dysplasia in your pet, get in touch. Dr. John with us, surgical head from Pet First, and so many questions coming in for him. He's going to be very busy between now and 5 o'clock. And the photos you guys are sending are just absolutely fantastic. I've just had a beagle with his tongue out. Send in your cute, your funny pictures, and you'll automatically be in the draw to win a 3-month supply of Purina Pro Plan. You can use, of course, the WhatsApp there, 04871 5500. That's also the way to get in touch. Do you need to go to the vet? Is a second expert opinion that you need? We're here to help on Dubai Eye 103.8.